Everybody, we're ready to start. Um, so I want to introduce you guys Dr. Luis Macias. He's a plastic surgeon at Marina del Rey, and he's going to present the presentation. So get up for Luis Macias.
All right, so as you guys heard, it was supposed to be a panel. You guys can see one of the other guys online, actually. They put it on YouTube, so later on when you guys are home tonight and you're bored and you want to hear the other guy that was supposed to be here, Michael Jimenez, talk, and actually there's a couple other panelists, just put in, I think it's COPE, surgery panel or something like that. It's about an hour-long panel, and you'll get probably about what you would have expected with the panel today, because Michael Jimenez, who's a trauma surgeon in South Los Angeles, myself, there's a female urologist on it, and another guy who's a vascular surgeon, who were the panelists. It's an hour long, and you guys can go through a panel in that fashion. Since it's just me and there's not a panel to talk about it, I gave a talk to CCM at UCLA back in November, so 2 months ago, and I figured I'd give you guys the same talk. Is there anyone from UCLA from CCM that heard this talk? Sweet. So it's a whole new talk to you guys. It's basically just how I got to where I'm at and the trials and tribulations and the experience. So I went to UCLA, undergrad, med school. This was very timely when I gave the talk because we just beaten USC for the third time in a row, and I was super excited about it. Now, what's funny is the first slide said I'm a professor at USC, or assistant clinical professor at USC, so it tears me apart every time I have to talk about being faculty at USC, because I really, really am a Bruin at heart, and I was really excited about this that day. So I was asked to discuss at CCM, and if there's anything else you guys want me to talk about, let me know. The overall journey of how I got to where I'm at now, the choice of pursuing the medical field. So how did I end up in plastic surgery? Because it's definitely not what I thought I was going to be when I was sitting in your chair. How, when, why did I choose what I do? My typical work day, balance between work and personal life, that seems to be a more and more common question that I get nowadays. It wasn't as important when I was applying to medical school, but it seems to be more and more important to people. What do I like most about being a physician? And then general advice to pre-meds. So this is my favorite book of all times. I'm not kidding, even to this day. Like every time I get into something that's really tough and I'm like, I don't know if I can make it through this today or through whatever, I just think about this book and I just keep doing the I think I can, I think I can. I used it in the Marine Corps. It was the version of I think I can was when we had to hike up mountains, and it's like 40, 50-mile hikes up mountains and all this, and you're like, I'm never going to finish this. I'm never going to finish this. But the drill instructor used to be like, just put one foot in front of the other. And I was like, just put one foot in front of the other. Eventually, if you put enough feet in front of the other one, you finish the whole 30-mile hike. And all you got to do is be like, okay, this next foot, and you just keep it doing. If you don't stop that, eventually you're going to finish the whole thing. And it is really hard to get the next foot going sometimes. But you get through a mile or two, and it gets easier sometimes. So just keep putting one foot in front of the other. Just think you can, and eventually you actually will. Next slide. How many people know this guy? All right, a few of you have heard of this guy, right? Abraham Lincoln. So this is a quote I love. Success is moving from failure to failure without losing any enthusiasm. So you're not going to succeed at everything you do. Most people don't. We all have had our failures. I've had my fair share. You probably look at me and go, wow, that guy's a plastic surgeon. It's really hard to get in plastic surgery. He's probably perfect. No, not perfect. Had a bunch of failures. And you need to just pick up from the failure and move forward. Do you guys know his story about how he became president, or how many failures he actually had before he became president? Does anyone know? What's that? He had a whole bunch of failures. As a matter of fact, here's a list. So, his famous failures. He failed at a lot of things before he became one of the greatest presidents in U.S. history. He tried to get elected into all kinds of offices. Probably, I think there's a list of 1 or 2 things he actually won, but he won like 5 times. He lost 5 times as many. But finally, he said, "Screw it, I'll be president." And he lost for vice president because back then I think you got voted separately for both. It wasn't a ticket where you ran together. He'd already lost for vice president, but said, "Now I'm going to be president," and he gets elected president, and then becomes one of the greatest presidents in the history. So he actually lived by that quote that I showed you guys before, and I think that all of you should too. So how did I get from your chair to into medical school, through residencies and fellowships, and now board certified plastic surgeon? Took a lot of hard work. It took determination. It took a lot of help from friends and family to help out in times of need, either emotional, financial support, and mentors. A lot of mentors. I think that one thing you'll learn through the process is that you don't need one mentor, but you need a set of mentors, and your mentors will be different mentors through the phases of your life. So I had a group of mentors that helped me get into medical school, and then I had a group of mentors that helped me once I was in medical school decide what I was going to go to in residency, and then in residency, another set. So it's always about finding people who are going to take a genuine interest in what you want to do, how things are going to affect your life, and help you make those decisions in your best interest, not necessarily theirs. Sometimes it's tough because sometimes a mentor might have their interest in play too. So you have to make sure that they're mitigating their conflict of interest a little bit as they're mentoring you. So this is me, believe it or not. Half my life ago now. I'm 40. This was 22 years ago now, actually. So more than half my life ago. I was 18 years old. I was at Nogales High School. That's where I went to high school. Anyone know where that's at?
Yeah.
You live in La Puente?
Yeah.
All right. So I went to Nogales High School and joined the Marine Corps. They told me I should take vocational courses like wood shop and auto shop because I needed to get a job after I graduated high school. But luckily, I took enough classes to actually apply for college, and I had a teacher. Her name was Mrs. Waska. She was my pre-calculus teacher, and she told me, "You got to apply to college." So I said, "Okay, sure, I'll apply to college because you're making me," and I applied to UCLA. That was the only school I applied to. Didn't apply to any other colleges, and luckily, I got in. But I was going to the Marine Corps, so then I had to not go to UCLA. I went to the Marine Corps, so I sent my application off. I didn't even think about it because Waska made me. And then I was like, all right, well, that's not going to happen. So I joined the Marine Corps. And then I got an acceptance letter at UCLA, and I'm like, okay, now what do I do? And I just went to the Marine Corps, and then I reapplied to UCLA. But that time, I was scared that I wasn't going to get in, so I applied to 2 schools, UCLA and UCI. Got back into UCLA, and then went to UCLA. But when I got to UCLA, that's when I really kind of hit a road. I didn't have to study in high school very much. It just wasn't a very good school. I could graduate at the top 10% of the class without really doing too much. So once I got to UCLA, it was a different story, though. I mean, I got a couple C's right away, and I went to another counselor who then told me, "Oh, well, good. It's not that great. You got C's, but you can recover. What are you thinking about doing?" And at that point, I had no idea. And I liked anatomy, so I thought maybe I could be a doctor, but I didn't know anyone who was a doctor. I didn't think that it was actually attainable, quite honestly. I thought it was already like a big deal that I was at UCLA. I didn't know anyone that went to UCLA for Nogales. So I was like, yeah, maybe medicine. And she looked at me and she said, "Well, not with C's." And then I said, "Oh, okay, well, then maybe not that." And then I just continued going to school, and eventually I learned how to, I got involved, next one, I got involved with, there's a thing at UCLA called AAP. It's basically some some mentorship and tutoring. And then there's CCM. I got involved. Have you guys heard of UCLA Prep program? You did UCLA Prep? What year did you do it in? 2013. I won't tell you what year I did it. So I did UCLA Prep. So I was going down Bruin Walk at UCLA one day, and I ran across a panel of people who were talking about going to grad school. I thought I was going to do research. And, well, you found it? The top ones? Oh, you got to pull the trigger? No, it doesn't work. All right, so I went and talked to these guys and girls that had a table, and they were talking about grad school. And there was all these different grad schools. I thought I was going to do research because I was doing a lot of research in the lab, and I really enjoyed it. It was intellectually stimulating. I thought I was going to write papers and all this. And then I ran across a table for UCLA Prep, and there's where I got a mentor. His name was Ray Prado. He ran the prep program at that time. And he's like, well, you should try this program. It's for people who are contemplating medicine but aren't sure that it's for them. And I'm like, well, I was kind of thinking about it, but I don't know any doctors. I don't know anyone that does it. So they're like, well, just apply and check it out. So here's this guy that's actually in your physiology class. He's done the program. He did it last summer. Talk to him. His name was Carlos Ruiz. And I said, okay, cool. I'll talk to him. He told me it was great, so I applied. I get in. And when I started that program, I met people that are now lifelong friends. I mean, my roommates from there on out that I'm the best man in their wedding, that I still talk to today, are from this program. And I met medical students and doctors that were real and that I felt I identified with and that I was very similar to. So it made medicine not that unattainable for me. It made it like, oh, if they can do it, I know I can do it too. You know, they came from very similar backgrounds. They had struggles just like I did. They had C's on their report cards too, and their transcripts, and they were able to get in. So how did they do it, and how can I do it? And they were the ones that helped me get, figure out how to make that transition from a not so great student to a student that could actually get into, UCLA School of Medicine. So Ray Prado, my buddy Dr. Quintero, Rodolfo Quintero, he's a fertility guy he does fertility in Glendale and Rancho Cucamonga. I don't know if you guys have heard of him on K-Love. Anyway, he's got some ads on K-Love. He was a OBGYN resident at the time. Well, no, when I first met him, he was a medical student. Then he became an OBGYN resident. And it was actually him who made me think about becoming an OBGYN. And thank God I didn't follow his tracks and went into surgery instead. And I'll tell you how that happened. I learned how to study at UCLA by mentors and CCM and the prep program. They really kind of taught me how to actively study. I was doing very passive studying since I didn't know how to do it in high school. I just didn't learn how to study. I guess back then we didn't really study for the SATs like you guys probably all did. You probably guys all studied like big time and took Kaplan or something for SAT. I just took it cold. We just didn't do that back then, or at least I didn't know anyone that did, so I took it cold. And when I got involved with CCM, there was so many people that we pushed and pulled each other, from the medical school. I mean, we were lucky at UCLA to have a medical school campus, right on campus. So we'd have our CCM meetings. We'd have medical students that would come and help pull us up, basically, into medical school, teach us what to do, tell us what to do. We had access to them to ask questions. And as a matter of fact, Efrain Talamantes, many of you might know who he is. He was an undergrad, was I med school, and the cycle just basically continued. So eventually, when it was time for me to apply to schools, I applied to like 35 medical schools, which I think that's about average now, 35 to 40. What are people applying to nowadays? Yeah, exactly. So back then, same thing, 35, 40 medical schools. I applied to that many. I think I got 12 interviews. I only went to 6 of them because I couldn't afford to go to all 12. and got into 5 of the 6 that I interviewed at. And UCLA was my top choice. No, I lie. It was my second choice. I didn't get an interview. It was the top choice of the places I got an interview at. I didn't get an interview at Harvard. So once I got into UCLA, I was basically done, and I didn't go to some really nice interviews that I probably should have gone to retrospective, looking back. But when you got no money, you just do what you can, right? And you're like, UCLA's fine. I'll stay here. So what did I do when I was at UCLA? I got active with the Latino Medical Student Association. You guys know who they are? Yeah, you guys have heard of the Latino Medical. They've got a great conference they put on annually. Consider going to it. It was something that when I was in medical undergrad, I went to a lot and met a lot of people that helped become my mentors. And that whole pulling up that I was talking to you about happened a lot through this organization called LMSA, the Latino Medical Student Association. So once I got into med school and I was on my first rotation as a third year. So the first 2 years of medical school are just book work, mostly. I had a longitudinal preceptorship where my second year, you're like, what do you think you want to go into? And because my buddy Rudy Quintero, I was like, well, OB/GYN seems interesting. And I got this longitudinal preceptorship, and it was in OB/GYN, and I was like, I hope he's not doing OB, because I don't really like OB, and I hope he's not in GYN clinic. I hope he's in the operating room. And obviously it hit me like a ton of bricks at that point that if I want to be in the operating room, I should just be a surgeon. But I started my third year in my OB/GYN rotation, and I fell in love with it because it was the first time I was actually trying to play doctor. I was on the wards, I was interacting with patients. It was fun. It was what I'd spent 2 years, well, even before that, when I was studying for the MCAT, envisioning that I was going to be doing. So I thought that's what I was going to do. So just be careful of your first rotation in medical school because you're going to love it. And like almost everyone that does their first rotation is like, oh, I loved psych. I want to do it if that was their first rotation or surgery because you're going to be really excited about being on the wards after all those years of studying. And then I decided on surgery because of what I said. I loved the operating room. I liked seeing an immediate change. So someone comes in, they're like, oh, it hurts down here. Or it hurts over here, and you take them to the operating room, and if it's on this side, you take out their appendix or whatever, you can fix them. And you see them come in sick, you discharge them, they're much better, they're happy, you affected change, and you saw it right then and there. There's other fields of medicine where your change is more subtle. Patients come in, you see 30 patients in a clinic, and you diagnose them with diabetes or hypertension, you give them medication, and the medications decrease their blood sugar and prevent disease in the future, and most people that you give the medications, but not everybody. So you're playing a numbers game, and you don't see the tangible benefits right there in front of your face. So for, I guess, more type A personalities, more people who like to see immediate change, surgeries seem to fit my career aspirations, my personality a little better. So I decided general surgery. I didn't know what kind of surgeon. I just thought, general sounded great. General surgery is basic. Does anyone know what general surgery is? Anyone? What is it?
It's just technically you don't have a specialty kind of thing, so you just do. Let's say you're in a ER or something, so you're like if there's a surgery that's going to be done, you get to do it. So you just don't have a specialty.
Yeah.
Like plastic surgery, for example.
Yeah, I guess that's a way of it. It's starting to become its own specialty in a way because as the other branches have come off, it's like its own thing. So general surgery was before, it was just like, all right, you're just a surgeon and you do everything, head to toe. And then orthopedic surgery came, head and neck surgery came, and they're starting to pick off all these different parts of the body. And so general surgery has basically become surgery of the intestinal tract, so the abdomen, and the breast, and mostly that's what most general surgeons do. Some do thyroids, but endocrine surgeons will do that depending on the specialty. But like if you have an appendicitis, general surgeon's going to do that. If you have a hernia, like an inguinal hernia, a general surgeon's going to do that. So that's what general surgery mostly does, is the intestinal tract and the breast and some hernia stuff. And then if you decide to specialize in general surgery, there's certain specialties in surgery that you go straight out of medical school, and those would be urology, neurosurgery, orthopedic surgery. Now plastics, you can go straight out from medical school. And then there's some that you have to do in cardiothoracic surgery. You can start doing it straight out of medical school now too, and they're trying to get vascular programs. But the older way was you'd go to general surgery, then you'd go to cardiothoracic, you'd go to vascular, you'd go to plastics, you'd go to that, and that's basically starting to diminish as people want shorter training programs and they want more of a lifestyle. They don't want to spend 10 years training. I spent 9 years in residency and fellowships. People don't want to do that anymore, so people want to go straight out of medical school into their training programs and make it shorter, so make it 6 years instead of 9. So that's why general surgery is actually kind of becoming a specialty, and they should probably call it something else so they don't end up getting their surgeries poached from them, because someone else is going to say, no, I'm the intestine surgeon, and then they're going to lose that too, you know. When I was in general surgery residency, I found another mentor. So again, it's all about mentorship. His name is Macias. I loved cardiothoracic surgery, and I loved plastic surgery, and I couldn't decide between the two. I really liked them both equally. Plastic surgery is very, very difficult to get into. You got to have really good test scores. You got to be published pretty well. It's very hard to get into. Cardiothoracic surgery, on the other hand, nowadays, is pretty easy to get into because the field is getting a little diluted because different cardiologists are doing the surgery. So I was thinking, well, I like them both the same. Maybe I'll go and do cardiothoracic surgery, and because it seems pretty cool and it's not that hard to get into. It'll be, I don't have to struggle that much. And my mentor was like, well, why don't you apply to both? And if you don't get into the harder one, and since you like them both the same, and then just apply to the easier one, and then you have a shot at the harder one, and you're not selling yourself short. And it's funny because when he said that, I was like, man, that's how my whole life has been, and I don't know why right now is just maybe I was just getting tired, maybe I just wanted a sure shot, afraid of failing, even though I've always said that I'm not afraid to fail. Everyone knows you're applying. Everyone knows you are going to apply to plastic surgery, so when you don't get in, it's a little like, oh yeah, I didn't get in. I'm going to do something else. But I said, hey, I'm going to listen to my mentor. I'm going to do what he says. I'm going to apply to plastics. And then, next one. This is Dr. Macias. That's the day I found out I was going to be a plastic surgeon. I walked over his office. I think he may have been the second or third person I told, but he was the first person I told in the hospital. I think I called my mom and the girl I was seeing at the time. Those were the two people I called before I went to go see him. And I was like, hey, I got in. And he's like, we got to take a picture. We got to take a picture. It's a big day. So we took the photo. And thanks to him advising me that I shouldn't be scared to fail, I actually got in, and I'm a plastic surgeon today. So what is plastic surgery? It's a broad field. Why did I go into it? We operate from head to toe. It's actually, plastic surgery doesn't own, similar to general surgery, we don't own anything. It's its blessing, and it's also its curse, because we don't own anything. Just like general surgery, people try to poach things off. Like the ENT surgeons are going to do like facial plastic surgery, and then the foot doctors want to do this, the breast doctors want to do that. So we have to continually innovate in the field of plastic surgery. So I bet many of you don't know that the first organ transplant ever was done by a plastic surgeon. So it was a kidney transplant done at Mass Gen in Boston, and it was a plastic surgeon who took a kidney and transplanted it to somebody else. And plastic surgery continues doing transplants. Nowadays, we don't do that. The whole solid organ transplantation became its own specialty, and they transplant, usually if you're going to do kidney transplants, you'll do liver transplants and kidney transplants and pancreas transplants. It's a whole separate specialty. But we've continued to push the field, and the other things that we now do as plastic surgeons are face transplants. You guys, those have gotten a lot of media attention recently, and this is a cadaver dissection of a face that we were doing at Penn, at University of Pennsylvania during my fellowship, to learn how to dissect the donor so that we could transfer the face on and do a face transplant at Penn at some point. So that we dissect the arteries and veins are coming, those two little things are coming off to here, are the arteries and veins that we would take and then reconnect to the person we're transplanting it to under a microscope. They're really, really small artery and veins that we would use suture that's as small as, like, thinner than a hair to connect the artery and vein together so that the blood supply goes from the person who's getting the transplant into the transplanted face and makes the face survive. There's also some nerve stuff that we got to put together so that the nerves in the face can get function and start working again. Here's another thing that we do.
How long does a facial transplant take?
It takes about 12 hours, 24, somewhere around there. Depends on how many you've done. As the centers that do them do more of them, they get faster and faster. We did a hand transplant at Penn, and so far the only one they've done there. I was a fellow there at the time, and it took us 12 hours to do, which is not too bad. It was 2 arms. We had 4 teams. 2 teams went to go harvest the arms from the donor, and then we had 2 teams preparing the recipient's arms for the donors. And then when the arms came into the room, we prepared the arms in the room and then put them together, and that all took like 12 hours once the arms made it into the room and we started. I mean, all in all, it was a whole day affair because at like 2 in the morning they went to go pick up the arms to start dissecting out the arms, and then we started at like 8 in the morning with the recipient. So here's another thing that we do. So this is a lady who had breast cancer 10 years ago, and she had, her right breast is her normal breast, obviously. Her left breast is on your right, her left breast, is a reconstructed breast with an implant, and she had radiation, and radiation makes things kind of shrink and get hard. So you could see that her reconstructed areola that they made on the left is higher than the right one, obviously. So at one point they were at equal points, and this has gone up. It's probably a little bit of the right one coming down too with time. You know, with age and weight, the breast can get a little droopier too. So it's probably an effect of this one coming up and this one coming down over time also. But she came and she's like, "Hey, what can you do for this? Can you make this any better?" And one of the things I went to go learn at Penn to do was to put together small arteries and veins. So actually one of the things we can do is take the patient's belly tissue, completely remove it from their belly, the whole belly fat, and then using an artery and vein that kind of go into the groin that feed that belly tissue, completely remove it, bring it back up here, and then connect the artery and vein back up to an artery and vein that goes under the rib cage so that tissue survives, and actually make her a breast mound that is soft, that looks and feels a lot more like a breast. Now, the scarring's not going to be great. You know, there's going to be a scar all the way around the belly tissue that I moved from here to here. But she didn't care about the scars. She just didn't like the rock-hard thing she had on her chest. She wanted something that felt and looked a lot more natural in a shirt. And when she hugged people, people weren't like, "Hey, what's that rock that you have on your chest?" So here's a photograph of her belly. And basically you can see that that's her belly button there, up there at the top. You can see kind of like cut out up there. This is her legs down here, her head's that way. And so her hip bones are basically at the sides here where I cut. And this is the amount of tissue that I take, and I'm moving up to her chest in order to make her a new breast from that. Next picture. So here's the little tiny artery that goes through the muscles that I take out and dig out, basically, so that I can take that little artery and vein and then bring it back up to the chest, connect it so that whole tissue can survive. Next one. And then here you could see that I took that hard, small little mass, and then I put that tissue in, and you could see here, this is where her belly button was before. So this was flipped this way down here, and that was where her belly button is. Now she's got her real belly button still there. I left that behind and brought it back out through another area, but this tissue just ends up getting taken off and put up here. I closed the area where the old belly button was, and now she's got a really soft, pliable breast mound that she can put a bra on and that she feels a lot more comfortable hugging people with. And I still need to reconstruct her nipple, but I asked her if she wanted me to lift her right breast, but she doesn't want me to lift her right breast. She likes it the way it is, which is why the left one looks a little low. I'm going to raise the left one a little bit and then do a nipple reconstruction and tattoo her areola. And then she'll have a much better, softer reconstruction. She had these ripples up at the top too of her chest, like right up in our axilla up here, that are much better, and she's excited about that too. Yeah. I don't have a picture. It's like she had, she had a little bit of extra tissue down here, and instead of doing a tummy tuck, for instance, where I can remove all that tissue and just put it in a bucket, I took that tissue off and I took out the artery and vein and I used it to make her a breast. So she ended up with like a tummy tuck and a reconstructed breast. She actually came to me for a tummy tuck, and I was like, oh yeah, sure, you could use a tummy tuck. And then she's, oh, and by the way, I've got this breast, and I don't like it. It's a rock hard breast. And I was like, oh, I know. I was like, you're the perfect candidate. This is awesome. You know what I can do? I can take your belly stuff. I can make a breast out. It's going to be nice and soft. And she was like, all right, let's do it. So I was so excited. She's excited. And it was, it's one of those like great cases that just makes everyone happy. And it's technically just a fun case because it's tough. It's got some risks in that the flap can go down, meaning the artery and the vein, because they're so small they can clot. And it's technically challenging, it's demanding. It's one of those cases that everybody knows that it's really kind of surgeon dependent. And I like that. I like that challenge. I like knowing that if I do a really good job, there's a really good chance this is going to go well. And if I don't, this flap's going to have some trouble, and I'm going to have to try to save it. It's high stakes, but I mean that's what surgeons kind of live for. It's a lot of responsibility, but it's not so much that someone that is interested in the field and has gone through a lot of training is able to it's not like it's a burden or it's a pressure that we don't like. Most of us like it, and that's why we chose the field. So plastic surgery residency, I found another mentor named Anthony Smith. He was my program director and also the chairman of the Mayo Clinic where I did my residency. And I really liked the reconstructive surgery that I did there and the cosmetic surgeries that I did in my training. So I applied to a couple fellowships, one at the University of Pennsylvania where I learned how to do that microvascular stuff that I was talking to you guys about, and then the other one at USC and in Marina Del Rey in cosmetic surgery. So I did both of those, which was 5 years of general surgery. Back then you could do 2 years of plastics. Now you have to do 3 years of plastics. And then I did a year of fellowship in the Penn Macrovascular Fellowship and then a year of aesthetic surgery fellowship. So that was 9 years total of training. You can become a plastic surgeon a lot quicker than that if you go the non-scenic route. If you go straight out of medical school, 6 years is the shortest you can become one nowadays. They've got these integrated and combined programs. But I did 2 fellowships, so if you did plastics plus 2 fellowships, like I did, it would still be 8 years for you. So it would only save you a year to get the same kind of 2 fellowships in the plastics residency. But having gone through, that's Anthony Smith. That's us in hiking Camelback Mountain in Phoenix. I'm not Brazilian, but I do like the Brazilian team. I do root for Mexico, #1 in the World Cup, but Brazil, they tend to do a little better, unfortunately. So when the U.S. and Mexico doesn't make it to the next round, I got to have a team, so it's usually Brazil. Because I didn't really like the light blue and white striped team too much. So, all right. He was instrumental in getting me those 2 fellowships that I got. I mean, they were really sought after fellowships. They're kind of hard to get. Sounds like I'm tooting my horn a lot up here, but I'm not. I'm telling you that it wasn't me that got these things. It's my mentors that got me them. They were really hard to get into, but someone helped me get into them. I was just like an average applicant, but because of the people that I associated with and were mentors and helped me out and believed in me And you know, obviously I had to do some decent work in his residency program, or else he wouldn't be pushing me, because it's his reputation on the line also. He made the calls and made it happen, and made me, you know, get into these programs. Because it's the further along you get, it's actually not even about your grades anymore. It's not about the test score or what have you. The further along, at the beginning it is. You need a great MCAT. You need great GPAs to get into med school. Don't let anyone tell you that's not the case. But as you get further and further along, who you know becomes more important than exactly what you know. So my current typical work week, it's not too bad right now, because I chose lifestyle. I usually have weekends off. I don't take call too much because I like my weekends. I like my evenings. Most days I work 9 to 5 in the office. On my operative days, which can be Friday or Mondays sometimes, I work from 7 to 3 or 4 is when most of the time I'm done with my surgery, and sometimes I'll see patients afterwards if I want to, or if I need to. A lot of times there's a need to see someone. And then I volunteer my time with USC. On Mondays I'll do hospital cases with the residents at the county hospital, or I'll volunteer with the residents teaching them how to do aesthetic surgery at their resident cosmetic clinic, where they do cosmetic surgery for very, what's the word I'm looking for? Very low price, because they don't charge a surgeon fee because they're still in residency and they're learning how to do these procedures. So they get basically nurses from mostly the county system that trust them to come in and, for instance, get a breast augmentation or what have you, liposuction, and we'll staff them and they'll do the case, and I will, you know, be the attending and supervise them, make sure they do a good job. But that's how they get their experience in their residency training. So I staff that a couple times a quarter, so almost once a month. I've been thinking about taking hospital call, and I keep thinking about it, and I keep thinking about it, and I haven't done it. Just residency was a lot of work. It was very tough, and I like my weekends to hang out at the beach, hang out with my friends, see my family, see my little niece. So it's been good. So balance between work life and personal life. Now, that video I talked to you guys about at the beginning, that COPE video, we talked about balance of work life quite a bit, and I found a different way of making balance of work life. I just basically made work my life. That's not a very good balance, but it worked for me. You know, I'm still single. I'm not married. My never been. So it was pretty simple for me just to take care of what I needed to take care of, and I think I didn't do a very good job of it. So I wouldn't be the exact person to talk to about balance between work and personal life. But there was a lot of people who actually did very well at it. As a matter of fact, I allude to it in that video. There's in the USC residency program, it's a majority females right now, and of them, they're all married, and the seniors all have children. They had children during their residency program. It's amazing how they do it. Like I can't even take care of me, and take care of myself. But these women can do it. They take care of their family. You know, obviously something's got to give. They got supportive husbands. They got supportive parents that help out in times of need. But they were able to find people that understood them and would help them through the process. So I mean, I think you got to also think about what specialty you're going to go into, and a lot of those specialties you'll find that have good income to lifestyle ratios are really, really hard to get into, like dermatology. You know, the hours aren't too bad in derm, and you make good money, so it's a lot of people that want good lifestyles and want decent money applying, so everyone tries harder on their tests and does better, and then they're the ones applying to those programs. Orthopedic surgery, lifestyle, depends on what you go into, isn't too bad, but they make pretty good money too, so they are also pretty hard to get into. So those are things to think about, that if you're going for one of those specialties that have a good income to lifestyle ratio, you are going to have to do a little bit better on your tests in medical school. And what makes me the most satisfying part of my day is actually when patients are happy and thankful, and I've been able to provide them with an experience that they are, happy with, and they're excited about either reconstructing their breast and they're able to get back to life, or dating, or they're, someone that's had a limb injury and I'm able to get them back to work. Like this guy who's I don't know, I wish I had known him. So I go to a meat market. It's actually a Garden, no, it's not Gardenas. It's that's the one by my sister's house, who lives out here. There's Gonzalez, Northgate Gonzalez Market over by where I live, and the meat market guy there, I knew one of them, but one day I go to the ER and it's a meat market guy from that market, and he'd cut his finger off. And I was like, oh man. So I put his finger back on. I'm like, I've never seen you at this place. And he's actually still healing, so I can't wait to go back, and once he's back at work, him be like, hey, let me cut your meat with his finger back on that I put back on his finger. That'll be cool. Because there was a time when I was in residency when I did fix someone's arm, and I'm going to the supermarket. I'm in my scrub still, and this guy at Coca-Cola, he's delivering Coca-Cola, and he stops me and he goes, hey, you're Dr. Macias? I go, yeah, what's up? He's like, dude, you fixed my arm. You fixed my arm. Honestly, I couldn't remember. I felt so bad. But I mean, it's so busy, during trauma and residency and all this stuff. I couldn't remember the guy very well or at all, quite honestly. But I'm sure I fixed his arm because he remembered me vividly. And he's like, thanks for fixing my arm, man. I got right back to work. It works perfect. And then when I was driving home, I remembered who he was, because when he said it works perfect like this, I was like, oh, that's the guy. So there was a guy that came in and he cut all his tendons, and I was in the operating room, and I'd called one of my senior residents at the time to come help me with the case, because it was a tendon laceration. I had to find the right tendons to put back together, make sure that when he wanted this finger to go up, this finger wouldn't go up. You know what I mean? And then he'd have to relearn what to do. So, or worse yet, another finger, right? He's going to try to point at someone and he does something else. So I figured it out, and I got it right, because the person that was going to come help me couldn't come help me. So I did it. I did it by myself. I thought I knew what I was doing. I was pretty sure. I'd studied. I know the stuff. But, it was the first time I was doing it all by myself when I was a resident, so I wanted a little backup just in case I was screwing it up. And it didn't come. I did it. So when I was driving home, I was like, that was the dude. It works. I was so excited. So there's another example. So advice, only go into medicine if you can't imagine yourself doing anything else. If you could do like banking, go do that. If you could become an auto mechanic and be happy, go do that. If you could do anything, I mean anything on this planet, do that. Because medicine, it's not going to make you money. Your peers are going to make probably more money than you in the long run, because by the time you get there, the opportunity cost in going through medicine is going to void all that out. So it's not about making money. It's about being a doctor, and about treating patients, and about doing something that you're really passionate about and a calling. Because there's going to be nights where you're going to be in residency and it's going to be really hard, and you're going to be like, why am I doing this? And if you don't have a good reason that's internal and that drives you to do it, you're going to either quit, or you're not going to quit and hate yourself for not quitting and continuing in something that you're unhappy with. So just don't do it unless it's the only thing you can do it, or the only thing you want to do. Never give up. Don't listen to the naysayers. If I had listened to them, I probably would have stopped. I would have stopped. I'd probably, not that it wouldn't be bad being a mechanic, because I'd be one good mechanic. I love cars. But if I'd listened to the naysayers, I'd probably be a mechanic, which I kind of am now of the body. But I ended up down this long academic road because I didn't listen to them. And enjoy the road. Really enjoy the road. I think people are so like, I bet you all you're looking at me going, I can't wait till I'm in his position, like till I'm done with all this stuff, this whole like getting through college and med school and just get through with my residency and I can be a doctor and live my life. No, I would give everything. I would give it all right now up to be back in your spot. I swear. The college was the best. the whole ride was really fun and amazing to me, and it was. I would give everything to be back where you're at. So enjoy it. Really do enjoy it. It's tough at times, but it's nice when you actually get to a goal. You strive. You get there, and you're like, yeah, I did it. Like that day, I got the first. I don't have a picture of the day I got into med school. But the day I got into med school, I was like, man, this was like. I guess at that point, it was only a couple years in the making when I decided I was going to med school, and I did everything I needed to do to get into med school. But a couple years in the making of making this happen, and it came true. Those highs are amazing. And even like the buddies that you'll make and the lifelong friends that you make along the way, you struggle with them, and that brings your bond together, and you never know, you'll be a best man or something at someone's wedding from someone you were studying with. This was a plug for the UCLA thing that I gave there. Just CCM, you guys obviously know about this kind of stuff. Mi Mentor, does everyone know about Mi Mentor? Mi Mentor is a website. Check it out. It's fantastic. It's one of the guys at UCLA who you're going to hear from later on today, Efrain Telemantes, Dr. Telemantes, and he's basically tried to make mentorship. We've always tried this informal mentorship stuff, and he's made this, it's a WordPress basically, where it's able to connect us all, people looking for mentors and mentors who are available and willing to be mentors. So check that website out. And this is basically it. No matter how you feel, no matter like how down you are because it was bad yesterday, just get up, dress up, and show up. Just don't give up, because you never know. Like, there's been so many days where I'm like, oh man, yesterday was so horrible. Like, I can't face tomorrow. And you just get up, dress up, you put your bow tie on, you show up, and you do well. All right, any questions? Come on, someone has a question.
How did you get used to like the bodies?
What do you mean, how did I get used to the cadavers, or to like warm bodies in the operating room, or like just naked bodies in the office? I mean, what do you mean?
Like opening them up and like, oh gosh,
So in the operating room, you mean? So the first time when I was when I was in medical school, and I was in the operating room, my first rotation, I saw a surgeon make an incision on an abdomen, and I was fine until I saw these little droplets of blood come up through it, and then I started feeling faint. I was like, and so then I had to sit down. I sat down, and the nurse comes up to me, and she goes, oh, it's okay, it's the mask. I go, no, it wasn't the mask, it was the blood. I know, because I was cool until I saw the blood. And then I was sitting there thinking, I guess I ain't going to be a surgeon. I can't even see blood. That's crazy. But everyone gets queasy from it at the beginning, but you get used to it really quick. It's like a non-factor. But it was that one day, the first day. So just you kind of get used to it. A lot of people get a little weird about it at the beginning.
So unfortunately we're out of time. So let's give it up for Dr. Macias. We have more questions you can talk to him after, but right now there's a 15-minute break, and we're going to have his friend from medical school, Dr. Efrain Talamantes, give the last